All right, so 5 reasons pregnant women are considered high risk. 5 reasons pregnant women are considered high risk. I'm Dr. Fatu Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. So you hear me talk a lot about being high risk all the time, about having a high risk pregnancy. I talk about this a lot because Black women are more likely to have some of these high risk conditions. So let's talk about some of the reasons why pregnant women are considered high risk and what we can do about it. All right. Number 1, hypertension. Hypertension is when your blood pressure is elevated, and we see that a lot during pregnancy. Women can come in with hypertension before they were pregnant. They have that high blood pressure before, or they can develop it during pregnancy. In some studies, over half of all Black women either come in with high blood pressure or they develop a hypertensive disorder of pregnancy. Preeclampsia, eclampsia, gestational hypertension, they have different names, but they are conditions where your blood pressure shoots up in pregnancy. They can really have bad outcomes. A worst case scenario, we don't do anything. Moms can have heart attacks, strokes, they can have seizures, they can die, babies can die. So it's a really, really big issue. And hypertension, cardiovascular heart disorders are the number 1 cause of death, especially for Black women in the US. So what can we do? We need to monitor blood pressures, make sure your blood pressures are controlled if needed, decrease your stress. There are other videos that I do talking specifically about what you need to do for blood pressure. All right. Number 2, diabetes. Diabetes is another very common high-risk condition. When your blood sugar is up, it can happen in pregnancy. Some people come into a pregnancy and they already have diabetes. Others, there's a certain condition that happens during pregnancy where you kind of have to have more sugar available in your blood to feed the baby. So because of that, pregnant women who are not otherwise diabetic can have diabetes just during the pregnancy. It's called gestational diabetes. Sometimes we treat it with your diet, by controlling your diet. Sometimes we use medications or insulin injections to control your blood sugars. It's important that we control diabetes because if we don't, you can have something called macrosomia, where your baby's huge and you can have problems with the baby being delivered or with the baby having blood sugar issues after they're born. There's something called intrauterine fetal death, where when blood sugars are high, sometimes the babies just die in a woman's belly. We don't understand it very well, but it happens. So diabetes is an important thing. The ways we can help: you need to monitor and control your diet, the carbs that you eat. If you have diabetes, monitor and control your blood sugars, minimize weight gain, exercise. Those are all things you can do. All right, number 3, obesity is one of the major high-risk conditions that we see a lot. Excess weight. Excess weight affects everything, in a pregnancy. Makes pregnant women more likely to have hypertension, more likely to have kind of heart conditions, diabetes, more likely to need a C-section. And so all of that leads to overall poor outcomes for mom and baby. We can help with that by working really hard before you're pregnant to control your weight, monitor and controlling your diet also while you're pregnant, and then exercise, exercising before and during pregnancy. That helps. All right. Number 3, a high-risk condition. Another one is when you come into your pregnancy and you've had multiple cesarean sections. We do know that cesarean sections by themselves are associated with a 3 times higher risk of death than vaginal delivery. So C-sections, there are times when they're needed, but yes, they're riskier than having vaginal delivery. So we have to work very hard to make sure that women have vaginal deliveries. But the more C-sections you have, the higher the risks. There's scar tissue, which makes it difficult to do the next C-section. It takes a longer time to get to the baby. There can be complications there. There's more chance that you can injure the surrounding organs in your belly that might require further surgery to fix. More chances of bleeding. So what we can do to help is that we work very, very hard to prevent that first C-section, because typically if you have a vaginal delivery the first time, it's going to be easy for you to have vaginal deliveries in the future. And then number 5, a high-risk condition is if you have a history of a postpartum hemorrhage. if you bled very, very, very heavily with your last delivery. Postpartum hemorrhage is a major cause of death around the world, and even here in the US, and it's something that tends to happen over and over again. You know, some of the risk factors are the more babies you have, the higher your risk of postpartum hemorrhage. If you have fibroids, for example, a lot of Black women have fibroids, that increases your risk. If you're having a C-section, you know, so the things we can do to help with that is very important. Treat your anemia. Make sure if you're anemic, that's treated, because if you bleed, then you're less likely to have complications from that hemorrhage. You know, there are things we do. We prepare in labor. We look at your history. We get things ready. You know, that's part of the reasons why it's best to deliver in the hospital sometimes, because if you have a hemorrhage, women can die within a few minutes of having a hemorrhage, and having all of the things necessary to stop that hemorrhage in a hospital are needed. So there are multiple, I just talked about a few of the top high-risk conditions, but there are multiple other conditions, chronic conditions like lupus, sickle cell, many things that can lead to a high-risk designation. All it means that we need to provide extra care and support for you. Sometimes we need to prepare better. We need the help of specialists, of high-risk doctors to ensure safety for you and your baby. We need to make sure your health is optimized before pregnancy. So Black women, we need to be aware of these high-risk conditions, and we need to know how we can prepare for them, how we can prevent them, and if you have them, how we can prepare for them, because we need you to survive and thrive, all right?